Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, what do you want to talk about today?
Well, Bob, I want to talk about hip replacements.
Okay.
That's why we got the skeleton here. We got the hip facing right towards the camera so we can get right into it. Now, if you need a hip replacement, it's because you have pain there from arthritis typically.
Sure.
So the doctor's going to explain to you about how the procedure goes. And right here, Bob, maybe you can
I'm going to go ahead
zoom in.
Yeah, I'm going to zoom.
Yeah, this is gonna, I'm gonna kind of run the show here, Bob.
All right, like he
You
thinks
take
he
care
always
of the
does.
camera because we need some good close-up shots.
All right, got it.
Okay, now a lot of people aren't really familiar with what the hip is, but you got the pelvis bone here, this paddle-like bone, and then the ball and socket right there is your hip. And what they're gonna do is cut right through here and take the ball off and replace it. And actually, while it's out, they're gonna saw, this is amazing how they can take the acetabulum or the socket, saw all the way around it, and then they're going to cement in a new socket as well as the ball. Sometimes they only do one or the other, that's called a hemiarthroplasty, but we're talking about a complete one. And then they're gonna tell you about precautions, what to do and specifically what not to do, because if this dislocates after surgery, it's a big problem. You do not want that to happen, and it can easily happen if you do
Can
the
you
wrong
show
things.
dislocation on there, Brad, or is that too tight?
Oh no, we can dislocate this model.
So dislocating means basically the hip comes out of joint.
Right, so if you dislocate, the hip literally is gonna pop out like this. And, you know, I say, obviously it's not gonna come off, there's enough connective tissue that's gonna hold it close to there, but it's gonna be painful. And they have to get that back in where it belongs, and then the tissues that you ripped apart from doing the wrong movements, this all
Have
has
to
to heal
heal.
up again.
Yep.
Big no-no. I've had at least a half a dozen people in the last 15 years do this. So,
I've had a couple myself.
I've had two of them go to a restaurant, and getting in and out of a booth is where it happened.
Interesting.
Yeah, so, and you can imagine why, well, we have to go through the precautions. Now, there's two major surgeries that they're gonna do. The most popular one is the posterior hip surgery, and that's where they're gonna cut in more from the back side of the buttock there, and here it's gonna be back in here. They're gonna get in and do their work. And then there's the anterior, and then what that means is they're gonna come in through the front side. Anterior means front. They're gonna cut in here and open it up from the front, okay? Now, we'll put our friendly skeleton off to the side now, and we're gonna go through precautions. Posterior. If you got a posterior, the most common one in the back, one of the big no-nos is, let's say, well, let's get a chair here, Bob.
Okay.
This is the one they're gonna tell you about the most, because it's the most easiest thing to happen, is if you lean forward, you drop your pen and you lean forward to pick that up. That is a really good way to dislocate that hip if it's a posterior procedure, okay? So no bending forward. Here's the hip is at 90 degrees. You do not want to bend forward when you're sitting. Or if you're standing, you're not gonna bend over to pick something up like that.
So when you say 90 degrees, Brad, you're talking about a right angle.
Right,
So-
exactly.
So,
No pun intended.
Yeah.
Right here.
So one line runs here, one line writes here.
Yeah.
That's a right angle. As soon as he leans forward, that's less than a right angle, and
Stressing all those
Stress on the
surgical
structures. Yep.
sutures. Okay, the next one. Posterior, you can't cross your legs. Okay? They say no adduction, or if you're sitting like this, you don't want to do this either. There's the midline here, that's right down the middle of your body. If this was the hip that was done, we can't go past that midline. That's number 2. And number 3 is, if this is the leg that's done, don't let those toes turn inwards, like that. Now the biggest
this
problem
is all still posterior, right, Brad?
right, all posterior hip, and where this is gonna happen most is if you're standing. Can you go right down to the feet, Bob?
Yeah.
Here's the foot that was done, and I'm gonna turn the walker this way, and I keep my foot planted and right there. Okay, it's not gonna matter when I turn.
Show
to
it,
the
do it
left.
wrong once, Brad. Do it, go all the way through it once and do it wrong.
Here, I'm turning and going that way. That is gonna be a.
Show how to do it right now.
Okay. You simply take small
little
steps and keep your toes pointed the direction you're going.
Yeah.
Small steps, take the stress off.
And just as a reference, that is exactly how the 2 or 3 that I've had actually dislocated their hip, was they were standing and they did exactly what you just showed.
Yep.
They stood on the one leg and then crossed over
Right.
the other one.
Now, the anterior procedure coming in from the front, this actually has some of the opposite precautions. Because they come in from the opposite side, you can bend over all you want, and it's not gonna dislocate because they didn't come in from the back side. Okay, so that's nice. However, and this one's kinda hard to do, you're probably not gonna do this anyways, but you're not supposed to bring your hip back like this, or extend back like that. Typically, you're not gonna do that anyways. You're gonna walk in a normal walk, but you're probably not gonna do a stretch like this after hip surgery. So
Sure.
that's not a big deal. The other one is hip external rotation. We just talked about the hip, you can't point in, but now with that anterior, you cannot point out. And this one's a little easier to do, because if you're sitting, a lot of people may have a natural tendency to let that leg come out like that. So you gotta be attentive to that foot so the toe is straight up. Do not let it go out. You can let it go in. You know, some people have that natural tendency. I'm one of those people that's comfortable. I'd really have to be careful for that, okay? So, and also when you're walking, if you're walking, you're gonna do a right-hand turn and the right leg is the involved one. I'm not gonna point like this and make the turn.
Right.
Again, small steps.
Small little steps, yeah.
Mhm. The other one's really easy. You cannot lay on your stomach. Most people have no interest in laying on their stomach after a hip surgery. And the last one, this is a very common strengthening exercise for the hip. It's called bridging. It's used very commonly, but you cannot do this and bridge up. They do not want that to happen, okay? Like that, no bridging. All right, so go through them quickly again. Posterior, coming from the back side, no hip flexion greater than 90, you can't bend forward. You cannot cross the midline, in other words, crossing your legs, and you don't want the toe to point in. Anterior, opposite, you can bend forward, you cannot bend backwards. The foot, you cannot externally rotate or point the toes out, cannot lay on your stomach, and no bridging. Okay, what do you say,
Well,
Bob?
I would say with all these, Brad, I would make sure to confirm these with your therapist or your
Right.
doctor. They might even have a couple other precautions.
Sure.
I've had patients that are not allowed to go into abduction at all.
Sure.
We just had one right now.
Oh, really?
Yeah.
Yeah.
And I'm not certain why, but there may be something that they found in the surgery. So, yeah, you know, these are good to go over with your physician or usually your physical therapist, and then you can, if these are all, what he says is correct, then you can review it on our videotape.
You
and make
better
sure that
believe
you
it.
understand them, so.
Yeah, and if you're 40 and over, you might need a speech therapist.
That's right.
But otherwise, tune into our videos.
Yeah, please subscribe.
You better believe it.
All right, thanks.